Alternative medicine. In the last few days, we're working about alternative medicine, and we're first raising a question, what is alternative medicine, of course? It's a very blurry definition, alternative medicine, and we're discussing, we're looking up internet sites, books, and we came to the simple conclusion, that alternative medicine is a less not evidence-based medicine, or maybe a less evidence-based medicine. But as well, it's a medicine that doesn't concentrate only on one organ, but rather on the patient as itself, at the head, how it's feeling, mental health, but also about physical disabilities and how it interacts with the environment. So we started to find some examples of alternative medicine. What therapies are there? So it's, for example, acupuncture. Then we heard, so in my city there are a lot of Chinese medical doctors. A cousin of mine uses chiropractic. Her mother was at the light therapy, but didn't work really good, so he used a little bit anthroposophic medicine. Then in the village nearby there's a herbal medical doctor. Magnetotherapy I heard is also rather good. On my holiday, I found some osteopathy. He was cooperating with a guy doing shiatsu. Spiritual healing. Yeah, my dog tried Ayurvedic medicine. And there's a lot of color therapy. As you can see, there are many, many therapies. And we're standing in front of all this mess. Kinesiology it is also. Last but not least, homeopathy, that most of you know. Standing in front of this board, we're asking ourselves, yeah, where do we go? It's a mess. And our task is to find some order into this mess. Currently, the Swiss government, 2 years ago, we had a vote, and now it's in the constitution that we have to consider complementary medicine. But what means considering complementary medicine? It's a blurry definition. We try to find some order into this. Why do we need order? The patients need some order, the scientists need some order, but also the government and the health insurance need some order in order to have a clear definition what we are talking about to make some regulations. In the next few minutes we'll present you how we bring some order into this mess. We'll present you our gold mine with some of the gold nuggets inside.
Samia Hurst, she gave us some important inputs. She differed between two types of sciences. Science 1 asks the question, how does it work? This question has to be answered in order that something is accepted by the population. Then there is Science 2. Does it work? Well, the word it implements here, does exactly this thing work? And does it have a different effect than a placebo? This brings up a new thing, because we know the chance of cure with a placebo for some illnesses is up to 30%. That's quite big. Then when some medication has such a massive effect, why should we prohibit it only because it's a placebo? Well, when placebo works, we can't prohibit it. Well, nowadays, alternative medicine is this. It's a huge black box. In order to open this black box, we should think out of our mind and give birth to a new field of science.
And then comes a question. What should the approach be? We don't have a correct answer. There's no wrong answer. There's just a proposal. And what is our proposal? The implementation of alternative medicine degrees and classes in universities, professional schools. Many of you may start to think now, oh my God, I'm not going to pay for that. My taxes are going to pay for something that I don't believe in. Many of you may also be atheists, I guess. Your parents' taxes and your taxes pay for what? Theology, right? So, what will this implementation bring to alternative medicine? It will bring a research with a new approach, which will eventually lead to new information and new knowledge. This information and knowledge will enable us to implement it in Constitution, wherever, if it is in there or not, or in Switzerland's case, to exclude it, if that's the case. You may start to think that this old cycle is too strange and you don't feel like it's going to work. But this is actually how alchemy became chemistry. There's actually a famous quote by Mr. Charles Fort, who said that witchcraft has many troubles until it is researched and it finally changes its name.
And as soon as alternative medicine will be accepted in the population, we will have clear regulations, etc. It will affect the healthcare costs. So currently, we are based on a complementary medicine system, more or less. We have school medicine, and if school medicine doesn't work, most people try alternative medicine. Let's label the X's, those are costs. Complementary medicine. In the future, when we have more evidence about alternative medicine and we know when we have to use alternative medicine and when we have to use school medicine, it will be clear how to use what in what time. So this axis will get smaller, and this axis will get smaller. And like this, we have an integrative model. We know exactly we have only to use school medicine if we have this, and we have to use alternative medicine if we have this. So we don't have to use both for the same disease, and we can reduce costs incredibly.
Which order do we came out to find? Well, it was actually too difficult. So, since we assume that all of you, at least we hope, know the alphabet, this is our order. We hope that in Proxima's future will come up with another order, but for now, that's it. Thank you very much for your attention.
And we also want to thank our coach, Leah, for cooperation helping us during the workshops, and Swiss Youth in Science for organizing this nice event. Thanks.
Thank you very much indeed.